the opioid and heroin epidemic, starring Mo, Tracy, Josh, John, and Chris.
The opioid epidemic. You may have heard about it in recent news stories. You may know of a friend that has fallen victim to it. And some of you may even have been affected personally. Why did it happen? How bad is it? And the biggest question of all, what are we gonna do? C. Opiate is a chemical derived from opium and is the key ingredient in heroin. Narcotics, like those prescribed post-invasive surgery, such as codeine, oxycodone, hydrocodone, are opiate-like in nature and are referred to commonly as opioids. Opiates slow down breathing and heart rate. Opioids and heroin exert powerful pain relief throughout the brain and to the rest of the body, latching onto the millions of opioid receptors throughout the body. When the drug binds to the receptors, pain signals are dulled or completely extinguished. Because of their tremendous ability to provide comfort for those suffering from intense pain, opioids are overprescribed amongst the general public, leading to overuse, abuse, and ultimate dependency that leads those affected to seek their fix in the cheaper, stronger, and more readily available heroin. In fact, a recent study found that 75% of recent heroin initiates first used opioid pills. Every 19 minutes, someone dies of an accidental prescription drug overdose. Most of the time, it involves an opiate, and it is now a more common cause of death than car accidents. Heroin use and dependence have grown dramatically in the United States over the last decade. Between 2002 to 2004 and 2011 to 2013, past year use increased by 62.5% and abuse and dependence by 90%. And the demographics of heroin use have changed as well. Over a decade ago, heroin was less prevalent and more specific to marginalized individuals in low-income areas and inner cities. But today, use and dependence have increased among all demographic groups. Heroin use has also doubled among those who have had historically low rates of use, women and white individuals. So it's a nationwide problem. But what about New York? Well, according to New York City Councilman Richie Torres, opioids were largely responsible for the 1,346 overdose deaths that occurred in the city in 2016 alone, a massive increase from 937 the year before. While preliminary numbers by the NYPD may indicate that opioid overdoses began leveling off in 2017, the epidemic continues to plague lower-income areas of the city, particularly in the Bronx and parts of Queens. Mayor de Blasio has called the issue a national crisis that warrants national solution.
Out, in and out, getting high, in and out the hole. I used to work a mechanic and AutoZone, in and out for 19 years. And like I told her, a normal person will not live down there, you know.
Judge. Why is the heroin and opioid epidemic a national problem? Why is it not just a personal problem? People are not being forced to shoot up heroin or take oxycodone. They do so of their own volition. However, as Roman Catholic social teaching tells us, we are to do what is in our power to further the common good. We are to pursue justice amongst all people. There are 3 Roman Catholic social teaching themes that lead us to acceptance of the epidemic as a justice problem. Dignity of the human person and respect for life. This problem is hurting and killing our communities. Lives are being taken, and it is our responsibility to recognize that and do something about it. Preferential option for the poor and vulnerable. The epidemic is systematically hurting lower-class individuals and families in comparison to the greater population because of a lack of access to proper treatment, resources, and support. This is a violation of this theme. Solidarity. We are called to community with our suffering brothers and sisters, especially when the suffering is ugly. We would not deny cancer patients or diabetics the treatment they deserve for their illness, and yet we turn our backs on addicts. So what steps have been taken by the government and people of New York City? What's the current action plan? According to the Wall Street Journal, the city has shouldered costs as high as $500 million related to addiction treatment and law enforcement. It's paid services associated with emergency room visits, $45,000 in 2017 for opioid patients, and public health campaigns, as well as distributing naloxone, a medical antidote to overdoses. Early into the final year of his first term in office, Mayor de Blasio tacitly acknowledged the worsening problem of drug overdoses from heroin and opioids, as well as the inadequate response of the city. He also announced an increase in spending and attention toward the issue. How much the efforts helped is unclear. Health and addiction professionals suggest that the city is appropriating too much money on police efforts and not enough on extending treatment. Act. Attitudes are beginning to change as more and more people are losing friends and family to use. A recent poll found that 2/3 of adults in the U.S. now favor treatment for heroin users, not jail. Essentially, the research has shown that the most effective method of navigating the complexities of heroin and opioid addiction is not through punishment and shame, but through education, advocacy, and awareness. This is one of those causes that is actually aided tremendously through conscientization and discussion of the problem. Early education of the dangers of opioid and heroin abuse are crucial. Programs such as DARE, or Drug Abuse Resistance Education for elementary and middle school students, should take less of a focus on marijuana, which has caused not a single overdose fatality in the United States, and more of a focus on the current drugs like heroin that are hurting and crippling our nation. Not only this, but the programs should provide a deeper understanding and awareness that drug users and addicts are not failures, they are sick. As one former DARE student turned drug addict has said about the program, I remember them really pushing us to believe that only losers use drugs. The program were a scared straight approach that appeals to people who aren't addicts. The biggest thing that sticks out is the emphasis on just say no. We practice saying no. I was on board with saying no to drugs. I think there was a really big emphasis on abstinence. They never really showed us the realities of drugs and alcohol. We all saw a black lung and looked at a liver with psoriasis, but the effects on your personal life were skipped over almost entirely. Zero tolerance, the entire foundation for the war on drugs, has proven ineffective in terms of actual prevention. Since the war on drugs, the prices of heroin have actually plummeted, leading to an increased availability of the drug. We don't lock up people for needing insulin. Why should we criminalize this disease? The most effective treatments for heroin and other addictions have proven to be doctor-supervised use, leading to eventual slow and controlled weaning. This kind of treatment is called medication-assisted treatments. Rehab facilities that don't offer medication-assisted treatments have a 100% relapse rate. Getting medication-assisted treatments is difficult to acquire due to high regulations by the DEA. Also, getting drugs like naltrexone, methadone, and bupropion are difficult. Methadone are found in clinics, and only authorized physicians can give out prescriptions like bupropion. Fewer than 40,000 U.S. doctors are authorized to administer Suboxone. Meanwhile, compared to 900,000 doctors that are authorized to administer painkillers like OxyContin and Vicodin.